everyone. Thank you so much for joining us for this next episode of Aestique Plastic Surgeons Secrets to Looking Your Personal Best. And tonight we're going to be talking about all kinds of things that are just for men. So guys may not be talking, but statistics speak volumes. A new report from the American Society of Plastic Surgery has revealed that more than 1.3 million cosmetic procedures were performed on men last year alone. And that is an increase of 29% since the year 2000. Today, men of all ages and walks of life are requesting plastic surgery for cosmetic reasons. Men's goals can include a more balanced nose, a rejuvenated face, trimmer waistline, among other things. So joining me this evening to spill all their secrets on cosmetic procedures just for men is Dr. Lazzaro and Dr. Camp from Aestique Plastic Surgical Associates. Welcome, both of you.
Thank you very much, and it's great to be here, and welcome to all our viewers and potential viewers.
Thank you, Brianna. This is such a fun topic because I like to pamper my man, and I think most women like to pamper their men. And tonight we're going to share all the secrets about how you can help your man be his very best.
We are so excited to learn all of these great secrets. So let's kick this off. And Dr. Lazzaro, what are the most popular procedures that you perform on men? There
are a large variety, and it differs in different gentlemen what bothers them mostly. But let's show a diagram here, and it really takes it from top to bottom. There are many non-invasive spa treatments that we'll talk about in a moment, which more gentlemen are taking advantage of. But if we look on the left side of the screen, BLEPHAROPLASTY is eyelid surgery. That's very commonly done and performed in men. Maybe not quite as common, but also a frequent procedure that we see, or otoplasty, ear surgery. RHINOPLASTY, nose, changing nose position, or after trauma or injury is very common. And removing lesions, removing benign or skin cancers, these are very commonly done on men. On the opposite side of the screen, from the top down, hair restoration is a very frequent procedure with gentlemen, and there are more different ways of doing this, and we're going to probably share with you what a lot of people don't know is a very good and effective way of treating hair restoration. RHYTIDECTOMY, which is facelift, is very common, both not only in women it's common, but very common in men as well. GYNECOMASTIA, which is enlargement of the breast in men, is a very common procedure. We find gentlemen usually do like breast, but we also frequently find, but not on themselves. So this becomes a common procedure of a contouring operation. And liposculpture, abdominoplasty, tummy tuck, these are also very common. We're going to share some of these with you tonight and show you some really exciting pre and post-op pictures that have been done at Aestique.
So let's get started and talk about the non-invasive procedures. Can you, Dr. Lazzaro, tell us a little bit more about this particular part that men can take advantage of?
Well, there are, at Aestique, we offer the full range of treatment. We have the top of the line non-invasive treatments, and there could be many reasons for your work schedule, for what's happening in your life, for time out, time down, that the non-invasive procedures work fabulously and are chosen. The top and most common treatment is skincare. Remember, the skin is our largest organ, and treating that and doing simple things, just using products that have a science base, and we have weeded that out at Aestique MediSpa, and really have used different ones through the years. And you'll see this says Gozo. This is a ZO. That's our skincare line that has science base to it. and uses some of the most effective, even prescription care products that are in part of the ingredients in this line, and it has been excellent. When people start on this, they absolutely love it and persist with it. And I use this, and gentlemen more and more are doing this. It's an easy thing to do. It's not a big ritual. You can apply this easily. And the other advantage of Aestique is you're going to have a skincare specialist as your coach. So if something goes on and you're not sure what's happening, it's a phone call away, and they'll instruct you on the proper use of it, which is really quite simple. Botox, you're seeing, is the most common non-surgical procedure performed in the United States. And this first picture on the top left is an example of Botox. This is a procedure frequently performed both in our Greensburg and Shadyside office in men and women. And you can see the difference right there of these forehead lines and the lines in between the brows, which still gives it just a natural look. Dermal fillers, which we don't have an example of here, but are common, very common in men, and obviously very common in women. Kybella was actually developed for double chins. And men are very common. You see this in women as well. This is something that can be done with a liposuction, but here is a non-invasive spa treatment that you can be utilized. And you see example on the top right of doing injections, and this actually dissolves the fat. And in the right clientele and the right patient, gives excellent results. Laser hair removal is very common in men and women. You can see the example on the bottom left here of hair or unwanted hair on the back, which could be done in the spa with treatments that are staged at appropriate intervals. BBL is probably the Mercedes or Ferrari of lasers. This is used for removing unwanted red or brown spots. And the example of this gentleman on the lower right shows that. And this is actually after one treatment, how the complexion, the combination of using the skincare ZO and these treatments work wonderfully. Medical facial treatments, massages, and different types of facials that we use skin microneedling to stimulate the skin. We're seeing women have been embracing this for a long time, and men are starting to do the same. And last that we mentioned earlier, certainly not least, is the PRP hair restoration. PRP stands for platelet-rich plasma, and this has been an exciting advancement in hair restoration. Years ago, we used to do hair restoration by taking plugs out from some part of the area of the hair where the hair was growing and transplanting them. This was a much more involved procedure and sometimes is necessary in certain individuals, but for people who are getting thinning, even women as well as men, PRP, taking drawing a little blood and taking that platelet-rich plasma and just putting it in the hair. This is a spa treatment. You can do this at staged, but you can see nice results, as you see on this gentleman, of that thinning area and filling that in.
And we also, for anyone that is watching and did not get to watch the webinar on hair restoration, our nurse practitioner, Marianne Woody, is the one that performs this, and she did a great webinar. So please check out our YouTube channel, Aestique Medical, and you'll be able to get a lot of information and see a lot more before and afters on that. And now that we talked non-invasive, let's dive into talking about more surgical procedures for men. So Dr. Kemp, can you please start us off with that?
Well, the scalp is really the top of the body. And for men who have thinning hair, they really have a lot more sun exposure on the scalp. and are prone to having some sun damage that can develop into bad things. If you look at this gentleman's scalp, he has several spots around the top of his scalp. The dark, large freckle is observable, as well as some red patchiness. But of course, the most worrisome one is the one that looks like a bullseye right in the center of the top of his head. This is a skin cancer and did require surgical removal. You can see the post-op picture on the right, the very large incision that is very well healed at this stage, but did require that much removal to get this skin cancer out. He has done very well and follows regular for skin checks. Being a very fair-skinned man, he is much more prone to having sun damage. And in patients who've never had a skin check, you should consider coming in and having some skin evaluation, especially sun-exposed areas. This often can be an insurance-covered procedure, even a preliminary visit to a skin expert. And we as plastic surgeons do offer this service. We also take off lesions, as Dr. Lazzaro described. They can be skin cancer lesions and often covered by insurance, or they can be just things that are bothersome to you, maybe not a cancer, but can be easily removed in the skilled hands of a plastic surgeon. So we would be happy to see any patients who are interested in having a skin evaluation or a skin check. If you were to have a cancer, we would put you on regular skin check appointments to make sure that nothing was developing. So this gentleman, we want to just focus on his eyelids. He came to the practice complaining that he really wasn't able to see well, and with driving and trying to look to the side, wasn't able to see well to change lanes or make turns. So his eyebrows are really sitting very low. His eyelids, the skin is folding over, covering the lateral part of his eye, and the eyelids are so heavy that they're actually pushing down over top of the pupil. His lower lids show some tear trough formation where some fatty changes happen in the cheek, and just gives him not only a tired look, but an aged look and also an angry look. So he came in for truly a functional improvement of his visual fields. And the next picture can show you what great improvement we're able to achieve. He had what we call a functional BLEPHAROPLASTY to his upper lids. That was an insurance covered procedure because he had a test called a visual field test that showed that his vision was obstructed by the heavy eyelids. And he also underwent a lower lid procedure to help improve that tired look to the lower lids. Now, the lower lids was not insurance-based, but the upper lids certainly were. And you can see what an improvement to both his upper and lower lids was achieved at one surgical procedure. So our next patient is a gentleman who really didn't meet the criteria for insurance-based work, but still has a heaviness to his lids. People are telling him he looks tired. His upper lids look full and a little bit on the droopy side. He really looks otherwise like a young, healthy man without tear troughs or sagging to the face. So he underwent what we would call a cosmetic upper lid blepharoplasty, just to improve that tired look to his upper eyes. So the next picture shows him in his pre-op and post-op. His eyes look a little wider, they look a little brighter, and it just gives him a more youthful, rested look.
Well, going into, we're continuing on the face, a very common procedure done in the United States on men and women are rhinoplasties. And this is just shaping the nose. This gentleman from the front actually doesn't look too bad at all, but you see on the side view, this is a common complaint, both men and women, is in the profile where they'll have a hump over the dorsum of the nose. The highest point that you should see on a profile should be down towards the tip. not over on the top where the bone and the cartilage meet. So on him, this is what bothered him the most. We're going to alter this, and you'll see on his post-op, you won't see a lot of change when you see his front view. He looks better. The top part of his nose is a little more narrow, but basically it's not a dramatic change because when you saw him from the front view, that wasn't what bothered him or what was noticeable. But now when you look at him on the side view, taking that fullness and hump over the dorsum out and putting his nose much more in balance really puts the whole face in more harmony and gives him the aesthetic result that he's looking for. There wasn't any problem with breathing here. Sometimes when people have problem with breathing, that portion, which is the smaller portion of doing the rhinoplasty, is called the septum and a septoplasty. And at times when people do have problem breathing, that portion of the operation could be insurance-based. But again, the major portion of reshaping the nose is considered cosmetic. Now, if you look on this neck picture, anytime we look at the nose, I also look at its proportion to where the chin is. And this young man, he didn't like that his neck was full, and he had fullness there with extra fatty tissue. And that he does have a fullness there, but he also has a recessive or drawn back chin. So if we look at a line, an aesthetic profile, your tip of your nose and the tip of where your chin is should be on the same line with the lower lip just off of it. His is very receded. So we're going to do a combination of liposuction or sculpture to his neck, taking fat out there. It's not going to, and also at the same time putting in a chin implant. This will put his face in more harmony. Now, when you look at him post-operatively, you'll see it gives him a stronger jawline, a more masculine appearance. He still has less fullness in the neck, and he just looks in more balance and more harmony. Sometimes these procedures, when there's a malocclusion or done with a jaw advancement or things like that, that wasn't the problem here. Here was purely his chin position. So this was just adding through a small incision under the chin and putting an implant. It even makes his position of his lip in a better position. It raises it up and puts the face into a more harmonious look. So we've gone so far. Dr. Camp talked about eyes. We talked about nose. This is a chin with submental lipo. Another common procedure, not as common as the ones you've just seen, are otoplasty or ears. And we can see in this gentleman, he was interesting to me because I had seen him many years before, maybe almost 15 years before. I saw him, and he had an injury on his right ear where it was 95% torn off. And you can see even where the suturing. So he came in and there was a little bit of blood supply maintained, and we actually put the ear back on, sutured the cartilage, and put this back into position, and it healed and lived, and he was fine. So years later, he does have a little bit of asymmetry when you look at him in the front and the back, where that right ear is protruding more than his left ear. And he also didn't like that the left ear was a little bit out further than he liked it to be. So we did a otoplasty, which is an ear repositioning procedure. That operation is done from behind the ear, where we go in, we modify the cartilage, mold it, and shape it, and bring the ear closer into the side. We don't want it pinned to the side, but we want it in a nice aesthetic position. Now, when you look at him on his front afterwards, you can see both ears were reposition the right ear, obviously more than the left, but actually putting him into more of a balance. So this is him on the front view, and you can appreciate the same from a posterior position where the ears are really more balanced than where they were. And another common procedure done on gentlemen, we'll see this often on younger gentlemen in their teens, where you'll see this earlier on men or boys than you'll see on women because of hairstyles. And when the ears are protruding, it's seen much earlier and not being able to cover with the hair that we'll see young men earlier to do this operation.
So now that we have talked about some of the procedures that you can do on the face and neck for men, let's dive into the body. Dr. Kemp, do you want to kick us off on this?
Well, that would be great, Brianna. And yes, let's move down the body to the chest. You know, Dr. Lazzaro described how men really do like breasts, but usually not feminine breast on themselves. And this is a gentleman who suffered from that very condition. You can see on his frontal view that his breasts kind of hang over, almost like a feminine breast. And it's really evident on his 3/4 view, where we can see that feminine shape to the breast, even ptosis of the skin. He may have a little bit of excess weight. He's still a well-fit man with good musculature, and he has disproportionate fullness of his breasts that do feminize his chest. Really a bothersome thing. It really interferes with self-confidence, interaction with the opposite sex, taking shirt off to play sports like basketball in the summer or swimming with family. So it can really interfere with a man's ability to be self-confident. So this is a man who underwent a breast procedure for gynecomastia. That's what we call enlarged breast on men. It's our hope to leave as minimal scarring as possible on the male chest. Now, this gentleman has some hair to his chest, so he would be more able to mask a scar. However, our goal is to try to avoid the scarring. And on the next picture, we can see him in a frontal view for his preoperative and then his postoperative pictures. And this procedure for him was able to be done through a small incision at the bottom of the dark disc or the areola of the breast, and through that small incision, we're able to take out the central mound of breast tissue. And then we also complement the chest by doing liposculpture and taking away the excess fatty structure throughout the chest wall and toward the edge of the arm. So when we look at him on the side view, you can see that he has still some early bruising, which he's only about 2 weeks post-op. But what a great improvement to his chest profile. No more sagging or ptosis of breast, a more masculine appearance to the breast with the nipple areola sitting low and lateral on the chest wall. You can see just at the top of his armpit area, that small red dot, that would be a liposuction port site where we made just a little incision to use our cannulas to then suck out or aspirate that tissue till we get a nice smooth contour to the chest wall. Really a beautiful result. A young man will be proud to be without his shirt for swimming or exercise. Lovely, lovely body shape. But this isn't the only area that men seek out help with. The next area that we're going to look at is the abdomen. Now, this gentleman is very physically fit, works out, has good musculature, but he just has this area of resistant fatty deposit, which we call lipodystrophy, fatty tissue that's resistant to diet and exercise. And this is the spare tire around the belly button area and the love handles over the hip. This is just not able to be improved by self-imposed diet and exercise. So for him, liposculpture is recommended. And this is where we can also use liposuction to tailor these areas get rid of that extra structure that just lingers after a good diet and exercise program has achieved overall body improvement and self-help. And so the next picture shows him on the frontal view after he's had liposuction. What an improved anterior abdominal wall. You can see the bulginess over the hip area, the love handle area is all smoothly contoured to his body's profile. And then on the back, which is an even great picture as well, showing that nice waistline tailoring down into the hips without the extra bulginess of lipodystrophy. So this is something that men will pursue just to get that extra improvement. We also do procedures that are more complicated than this, and sometimes even combine procedures. So I believe our patient might reflect that.
You can see what Dr. Camp was just mentioning of a combination of procedures. This gentleman, you can see the gynecomastia and the enlarged breasts that Dr. Camp was referring to. He also has a large circumference around his abdomen and back with some redundant skin as well. So there really are a couple different things that are bothering him. We like to even take a more holistic approach and actually really discuss where our the gentlemen or ladies ideal, not ideal, but realistic weight. Because if we're going to remove excessive skin from the abdomen, and you can see this little, what we call a little pouch hanging over, or pannus, removing that, we'd like to have the person be within about 10 pounds of a realistic weight. So anything we can do of even steering them and making suggestions of, there's no diet that works. It's a combination of smart eating and exercising and burning this, not exercising of going to gym 5 days a week. Some things as simple as walking for an hour 3 times a week will get the body in a cycle of a burn, and that combined with smart eating, not eating in between meals, will help you get down to where you realistically feel like you want to be. And that operation of taking the excess of skin from the abdomen is dependent on that. The breast procedure of decreasing the size of your breast, or doing the lipo around the spare tire that Dr. Camp just showed, that's really independent of it. So we can set this where we can have this gentleman, as he did, go down, get into his smart eating, doing his exercise, and while he's doing that, even help motivate him more by doing his operation on his breasts, shaping that as you saw, and also doing a lipo totally around his circumference. This will get rid of unwanted fat that won't go away with dieting. It'll also serve as a motivation for him to even get further to the proper weight he wants to be. Then we can go back secondarily and remove that excessive skin, and it's not going to change much if he goes down another 10 pounds, or if he puts on a little weight, actually it'll tighten. So we did that in this gentleman, where we did the gynecomastia, removed the excess through the areola, pigmented portion around the nipple, and lipoed him. Then he got down to his planned weight. We went back and did an abdominoplasty. And now let's look at the transformation of this gentleman. It looks like what he was hoping he could possibly look at, but never saw. Because again, he wouldn't have any control over his breast shape or the love handles. And now he's down to a weight that he wants to be and has been motivated to get there. And we go back and finish this off with tightening up the skin and putting him into a position that he didn't know was possible. And we'll look at him on a side view, and you can appreciate that as well. So there's lots of tools, and we have to work on them together. It isn't doing a procedure and that does it. It has to be working on both and having the gentleman or woman actually doing the things that are helping them as well. And we certainly can assist on things they can't control.
A common question that people have asked in this instance with liposuction is, once you remove that fat, is there a chance for that to come back? I know when we saw that picture of the first gentleman who was very fit and had a little bit of a spare tire area, sometimes they just want to get rid of that. Can that come back?
That's a commonly asked question, because we have some people who did lipo in an area, let's say in their thighs, and then later on they saw they were getting more full, not in their thighs, but in their love handles. And they said, well, gee, that fat went from there to there, and it doesn't do that at all. That's a myth. If you put on more weight, you might see more weight gaining in other places that you didn't notice it as much, because the areas where you usually did notice it was contoured. So that doesn't happen. And people who stay in similar weights, really, it is controlled and doesn't go anywhere else. And once that fat is out, it's out. It doesn't come back. It doesn't mean you can't put on more weight in that area, but you'll do it in sequence or symmetrically with the other parts of your body.
Well, thank you for answering that. I know a lot of people have asked questions about that before. So now that we talked about that, let's move back up to the face. Dr. Camp, do you perform facial procedures on men the same way that you do on women?
So that's a great question, Brianna. And from a surgeon perspective, the techniques that we do use are similar from men to women. However, the facial features and the body features are quite different from men to women. And so we need to honor those features. We don't want to feminize a man's face. And in fact, if I can show my next patient, this is a gentleman who came in because he had inherited a heavy congenital brow and upper lid. And at this stage in life, he was noticing his vision was being obstructed, or he couldn't see because the eyelids were getting so saggy. His brows are very heavy. He almost looks angry in this picture, even though he's not angry. And you can see on his side view how low the lid sits. It's actually pushing his eyelashes down, the heavy skin of the lid. So in addressing him, we don't want to give him a high arched eyebrow like women prefer. We want to keep his brow more in position to the male appearance, which is more of a horizontal look to the brow. We don't want to give him a great big wide upper eyelid. He doesn't need to put eyelid makeup on, but we do want to give him a small upper lid that's visible for a refreshed look, and take away that tired look that he has. And so the next picture, we can see his appearance just 2 weeks after a combined brow lift with an upper lid eyelid lift. Now, also in the male patient, especially one who has receding hairline or thinning hair, we prefer not to do a brow lift through the forehead with incisions, because those scars would be visible. There's no hair to hide or mask the scar. So in this case, this patient had the brow lift done through the upper eyelid incision. So the techniques are very well trained in plastic surgery training. This is a procedure that's done very commonly in combination, more for men than women, with the trans-bleph brow lift, but it certainly is a technique that works very well and minimizes scarring for both procedures at the same time. His brow maintains a good masculine look, and we have just a small show of his upper lid above the lashes. There's no more heavy weight pushing down on his eyelids, and just a very good refreshed look, an almost rejuvenated look. And we can see the same improvement when we look on the side view, how his eyebrow is brought up above the orbital bone. yet it maintains a nice horizontal appearance. He's not working hard to keep his eyelids open because the heavy eyelids is gone. It's not pushing down on his eyelashes anymore. So this is a combined facial and forehead procedure, very common for masculine or male patients to come in and pursue this work.
He actually looks younger too in the picture. It really changes him, even though it wasn't something that was very major. It's a great result. So now that we talked about the brow lift, let's move into a bigger procedure and talk about a facelift on a male. Dr. Lazzaro, can you walk us through that?
Yes, and as Dr. Camp mentioned, there is a difference in the anatomy with male and female and different things that you want to honor. One common thing, if you see in this gentleman that bothers men almost more, they think it's a different part, is their neck. They don't like that turkey waddle appearance. And the face, you can still see where it's coming down and getting hollow, but the neck is a big concern for them. Sometimes you can do a neck by itself, but oftentimes just bringing that back up just accentuates any looseness in the neck. So we will do this on an individualized basis of when you can do a neck alone or you do it in combination. In this gentleman, we did it in combination. Very clear picture of difference between a man and a woman. On a man, he has a beard pattern. So when you make your incision there, if you raise up his sideburn, he can just grow it back down. As opposed to a woman, if you raise their sideburn up and then it's high, it can't grow down and it's a telltale sign. So designing your incisions in men and women are very different. You want to get the same result, but how you get there is different. So in this gentleman, you're going to see in his post-op picture, it just gives him a more refreshed look. He gets more of a heart-shaped face. He looks more refreshed, and that's what gentlemen and women are looking for. They're not trying to look like they're 20 years, 40 years younger. They're trying to look a more refreshed version of themselves. So he gets a more refreshed version. The area that you can see on the front is around where his beard goes. That's where he has a little bit of that jowling. You can see that puffing there, which comes back. And even on the corner of his, where it's hidden by the beard, but you can see that jowl comes. This becomes cleaner and he gets a sharper jawline on the front view. And you can appreciate it much more on the side view because, again, that turkey waddle gets cleared out. You really don't see incision lines. They'll be pink and a little bit, but they're very camouflaged nicely, and it's not something that gentlemen have to be self-conscious about, or women for that matter, because the incisions are put in place and they heal nicely, and the improvement is a good trade-off. If you look at this next picture of this gentleman, it wasn't so much he had, yes, a little bit in his neck, but he had something of more that you see in the face part, where he has the parenthesis coming down from the side of his nose to his cheeks. There, he has a little bit of jowling here, and has some laxity in the neck as well. So again, we're going to bring the side of the cheeks, the jowls, and the neck back, and camouflage the incisions. So we're just giving him more arrested, refreshed look. Now let's look at him on the front. Again, it gets a more heart-shaped face and smooth, but not a pulled look. Looks still natural. And on a side view, the same thing. And you're not, when you look at them on the side and you're looking around for incisions, you really don't see them. They heal nicely. They're very well camouflaged, and you can get a refreshed trade-off for this.
And what about with younger men? What if a younger man is not ready for a facelift? Is there anything that you can do to help rejuvenate them?
This is probably one of the most exciting new things that we do in plastic surgery, both on men, women and on men, taking and building up structures of them which will help them age better. They might not have parentheses or neck sagging. And case in point, let's show you the next gentleman. If you look around where the parentheses are, or the jawline, or the neck, he looks very well. And they're the things that a facelift address. Now, what he has is he has a tear trough under his eyes, and he has some deflation there, as well as deflation in his cheeks. So this becomes a procedure where we're not taking anything out, we're not making any incisions. We're taking fat from some other part of his body, as you've seen maybe in his handlebars or around his belly, and then actually preparing that. And this happens to be very well stem cell laden, which gives you another advantage of helping further rejuvenate the skin. I'm putting it in around his eyes and building up his cheek, and it gives him more balance there. You can do this same thing in the spa as a non-invasive treatment, where you can put filler in the cheeks and blend across the eyelids, and it gives a very nice result. The trade-off is, the benefits is you're not doing a procedure or surgery. You can do this and it's minimal downtime. The downside is you're not going to get the longevity out of it. It's not going to last as long, but that could give you time when you wanted to proceed with something more involved, of doing something smaller. So at Aestique, we offer the full gamut, where you're able to do this non-invasively, minimal downtime, and get a nice refreshed look. And then maybe when your situation changes with work, with time off, you can do something more permanent. Now, this gentleman, we did this with the fat. We took fat out from around his belly and love handles, and then put that across his eyelids, build up his cheeks, and it puts him into a nice balance. And this fat is two-thirds of this is permanent. So this isn't something that you redo. Maybe if a little bit came down and you wanted to touch it up years later, you could. But in the majority of time, I'm seeing these people out 2, 3 years later, 4 years, and they're still in a satisfactory position. Now let's look at him after. And it really is actually quite dramatic. There's no incisions. This is done through a needle prick and place the fat in. It's very precise. This isn't just squirting in fat and hoping that that goes where it wants to go. It's really done with very fine precision and putting this in. So this has to take up a blood supply, and it does, and it lasts. So you can see the difference of the balance of his face, from his cheeks to his jawline. That heart-shaped face we were mentioning earlier is restored. No facelift, because we didn't have to do that. So we build up the other areas, the central portion. And we have another picture of him on a side view. This has been a wonderful tool that has been addition to our armamentarium as plastic surgeons, where it's not only the tailoring and tightening, now it's the sculpting, that we can use this and use parts of their own body where they don't want the fat, take it out and put it someplace else. Gives them actually a double bonus.
And staying on this theme, when you're talking about fat transfers, can you, if you have a gentleman that has, like the first picture in the lipo we saw, that very small spare tire area, can you take enough out of there to do what you did on a face like this, or do you need to have more fat to do that?
Well, the answer is you can most definitely do that. Now, the amount of fat that now we prepare this in real time. Years ago, they used to have to take the fat out, send it out, get it prepared, have white cells, red cells, fibrous tissue removed, and then you would come back later and then put it in. So we've advanced where we can do this in real time, take that fat out, prepare it, and have it prepared so we can put it in right in the same procedure. But taking that out here, you can easily use that for that. Now, there are other places we put fat. We put it in the backs of hands. We put it in breast. Dr. Camp uses it for breast reconstructions, of making breasts. We can use him in Brazilian butt lifts. Not more, obviously, you don't see that in men as more as in women, but in those cases, you need much more volume. And you have to take plat from multiple places to build that up. In here, taking it from the love handles or abdomen works beautifully.
That's exciting because there are a lot of men that have just that little bit of redundant fat that are diet and exercise resistant, and they really can't do anything. So it's nice to know they can have that taken out and have a more refreshed look. And if they have more excess weight and they want to have more fat removed, they can get sculpted. So it's great for patients.
Yeah, as I said, it's probably the most exciting advancement in plastic surgery in the last 10 years. That it gives us a tool that you get a double benefit. Get rid of it where you don't want it and put it where it can help rejuvenate you.
And now just to jump on some more questions, we mentioned in the beginning that the ASPS revealed a study that more than 1.3 cosmetic procedures were performed on men in the past year. Dr. Camp, what do you think the main reason is that's driving that number up for men?
Well, Brianna, I think in our modern society, we're very health conscious. We are more attentive to working out and trying to maintain a better fit body. And I think with time and age, it's just hard to get to that ideal spot that you work very hard to achieve. And a lot of people just need a little help to get over that last hurdle, such as liposuction to that spare tire, or an upper lid blepharoplasty because the skin is now sagging, which doesn't go away on its own. So I think a lot of good health conscious people are hoping to look as good as they feel, and they've worked very hard to feel very good and healthy. I think that's a big driver of a lot of these decisions.
And Dr. Lazzaro, what about you on that same topic? Do you think there's any other reasons that are not personal reasons, like not vanity, but reasons like that? Is there another driving force for men to want to do that these days and have more procedures?
I do. I think Dr. Camp's reason is really a primary driver, but there are other things in our evolving society that are happening. One is a really good thing is we're living longer. We're taking better care of ourselves. Life expectancy is longer. So we're really working longer. We're in there, and the beauty of that is we have, as we get older, comes more wisdom. But now we're competing with people who are much younger, and you want to actually look more refreshed. So that gives them an additional impetus for doing procedures. And one other one, which is a big one, and maybe not spoken about a lot, is divorce rate in this country is about 50%. And that's for men and women, obviously. So being older, and now all of a sudden you're in a different type of role and you're out courting or being with looking for another mate, makes you more conscientious about your appearance. And we see that coming in as more of an impetus of a desire to move off and proceed with something else.
That's a good point. I think that people, when they want to do it for themselves and it's to feel better, that's the best reason that you can have, whether you're a man or a woman.
Absolutely.
Well, we are so excited to have heard all of this information. I hope all of you that are watching, either live or watching a recording of this, have enjoyed it, and we want to continue the conversation. So please, if you'd like to schedule a consultation, we can either do it virtually in the comfort of your own home, or you can come into one of our offices in our Greensburg or Shadyside location. We invite you to come and see Dr. Lazzaro or Dr. Camp for a complimentary consultation. You can email info@aestique.com, and I would be happy to get that scheduled for you. And as a nice bonus, this is our kicking this off for Just for Men for a little Father's Day gift. We are offering $500 off the surgical procedure as well. And something really exciting that we have going on, just a reminder, we have a webinar next or 2 Thursdays, on Thursday, June 25th at 7 p.m. And it's really talking about something that is very important, and it's why credentials matter. So Dr. Lazzaro and Dr. Camp, would you please elaborate on that and give our viewers a little taste of what that will be about in 2 weeks?
Well, there are many physicians who advertise for cosmetic procedures or self-pay procedures. And just because you advertise doesn't mean that you have potential to do all the work that needs to be done for patients. And so when we talk about credentials do matter, being a board certified plastic surgeon is just the elite credential for performing not only reconstructive surgeries, which can be very complicated, but even a cosmetic patient where detail really matters. So in this regard, board certification is important, but even understanding what that board certification means. And then the other credentials as members of the ASPS, American Society of Plastic Surgery, and ASAPS, the Society of Aesthetic Surgeons. Both Dr. Lazzaro and I belong to these organizations. They are the elite of the elite who are members of these 2 organizations who can offer cosmetic and reconstructive surgeries to our patients. And you should feel confident that we are graded by our peers for our outcomes, not just our patients, but our colleagues as well. And it's an honor to take care of patients, and we both have the credentials to do it and to do it well.
Dr. Lazzaro, would you like to say anything about that?
Well, I think Dr. Camp really said that very well and echoes my feelings completely. Many people know we did a TV show for 11 years on WPXI and PCNC. That was the main impetus of it, was to tout credentials of the 2 organizations Dr. Camp mentioned, which will, in the 2-week show when we're going to go over botched, some of the patients we're showing, or people like this, were the main reason and impetus for doing this program, where we would have people come into the office and say, this plastic surgeon really messed this up. And I actually felt like they were giving our whole profession a black eye when they really weren't what a plastic surgeon. It doesn't mean we as plastic surgeons with good credentials can't have complications. The only person that doesn't have complications doesn't live on this planet. Sure, you can have them, but they should be much fewer. And if they happen, you take care of them and get a satisfactory result. So I think this will be an exciting show, and a lot of people know about the program Botched and different things it talks about. So we'll give Aestique's version of that, and also really tout and show you how to look for credentials no matter where you are in this country, not only just coming to Dr. Camp and I, but no matter where you are, how you can navigate this or tell your friends and relatives how to do it.
That's going to be definitely a great episode that you don't want to miss. So again, that's on Thursday, June 25th at 7 p.m. And we're really excited to see all of that great content that you both have to share. And we are doing next week another episode of Spilling Secrets from the Spa Aestique. We will be talking about BBL treatments, and most commonly the Forever Young, which is the photofacial, Forever Clear, which is for our acne patients, and Forever Bare, which everybody is jumping into right now to get rid of any of that unwanted hair that they don't want to shave for the summertime. So be on the lookout for that. We'll be releasing that on Thursday, June 18th, and we'll be excited to share that with you. And with that, thank you so much for watching this next episode of Aestique Plastic Surgeons Spilling Their Secrets and learning all about the procedures that are tailored just for men. It was really exciting. Dr. Camp and Dr. Lazzaro, thank you for your time. We appreciate you being here with us this evening and sharing all of this knowledge and information with our viewers and myself. And just please, if you don't like us on social media already, we have a great campaign going right now. You can win an iPad. So you'll want to go to Facebook. It's Aestique Plastic Surgery. And also on Instagram is same name, Aestique Plastic Surgery. There is a page there. You can like it, share it, tag your friends, and you'll be entered to win an iPad. It is full of great content. There's so many before and after pictures. We're going to have some live things happening on there as well. So please head over and check that out. And you saw a lot of wonderful things on all kinds of different procedures today. Our YouTube channel, Aestique Medical, has lots of past webinars that we've done. Please go and subscribe to it. Take a look at them. You'll be able to learn a lot. And we hope to see you in the office, either virtually or with us. And we hope we help you live life counterclockwise. Have a great evening.
Good night. Happy Father's Day.
Good night. Thank you.